Okay, hello and welcome to today's Lunch and Learn. My name is Dani Brown and I'm the partnerships lead here at Hint Health. I'm joined with Gem Sleep. I've got Kellie Jax and Dr. Mike Howell joining me. Hello, you guys want to intro yourselves?
Sure.
Thank you, Dani. Please go ahead, Kellie.
I just wanted to say good afternoon. Thank you so much for having us. My name is Kellie Jax, and I am the head of sales at Gem Sleep, and I'm looking forward to the conversation today.
Me too. Thanks, Kellie, and thank you, Dani. I'm Mike Howell, and I'm the chief medical officer of GEM, and I'm a professor of neurology at the University of Minnesota.
Awesome. Thank you for squeezing us in between your patients today.
Yeah.
Dr. Howell is an active practicing physician, so we love that because that's who our primary audience is and that's who your peers are. So it's nice to be able to have this conversation and kind of, bounce some questions around. So here's your reminder. You can see if you have any questions, please drop them in the chat and we can answer them as we go. We love the interaction from our viewers, so keep them coming. But today's conversation, we're going to get into brain health and how Gem Sleep is helping with diagnosing sleep apnea, all the things that go along with that. So we're going to jump in, and I believe Dr. Howell is going to kick us off with kind of a story that he's got.
Sure. So, thank you, Dani. So sleep is just inherently fascinating. It's a third of our lives. We're unconscious for the night, hopefully, anyway. And this is critically important for brain and body health. And what we focus on is making the management of obstructive sleep apnea very straightforward for providers and for patients. Obstructive sleep apnea is incredibly common. At least 40 million Americans right now are struggling with untreated obstructive sleep apnea, and that number may be as high as 70 or 80 million. This is a great time to be having this conversation. It is Dementia and Alzheimer's Disease Awareness Month. My day job at the University of Minnesota, I'm a neurologist who researches how we can better help protect our brains from neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease by sleeping better. And so sleeping better is one of the best ways to help prevent Alzheimer's disease. But sleeping better is good for all sorts of other reasons as well, right? Most notably, you just get a good night of sleep and you wake up feeling refreshed. The stresses that you were dealing with before you went to bed hopefully are put into better perspective when you wake up, but that's only if you sleep well. Sleep is also incredibly important for, you name it, what is it that you're trying to do better? So one of the challenges that we've taken on at GEM lately is to help professional athletes sleep better. And that's been a lot of fun to help discover new ways in order to improve performance on the court and on the field by sleeping better. A little bit of a deep dive in terms of what exactly is happening when we are sleeping. A lot of things, energy, brain circuits, and clearance of toxins are just three. Number one, your brain needs energy, and over the course of the day, it burns energy. It burns ATP, adenosine triphosphate, and it needs sleep in order to refuel that energy source for the next day. Interestingly enough, a byproduct of that ATP metabolism is adenosine. And adenosine builds and builds and builds over the course of the day. And many of you may be enjoying an adenosine antagonist right now. That is caffeine. So if you are having a cup of coffee or tea or soda with some caffeine in it right now, what you are doing is you are blocking some of that buildup of adenosine that's building up in your brain right now. Number two, your brain actively processes its circuits at night. So when you're sleeping well, you have more signal and less noise inside your brain. So what your brain is doing is it's clearing away the noise and the little connections that are not particularly relevant for your life or survival or relationships. And then it's amplifying the signals that are particularly relevant and germane for your life. So hopefully after a good night of sleep, you've wiped away the noise and you've amplified the signal. And then lastly, and this is what is I'm most excited about in the research we're doing in terms of the relationship between sleep and Alzheimer's disease, is that it is during sleep that the brain clears out its toxins that build up over the course of the day. In our bodies, we have the lymphatic system. The lymphatic system clears out everything from bacteria to metabolic waste products that our cells build up. And we've known about the lymphatic system for 25 centuries. It was only about a decade ago that we discovered how the brain does the same thing. The brain clears this out through a process called the glymphatic system. We don't need to go through the details. A couple points that are really fascinating is when you go to sleep, in particular, when you go into deep sleep, all of your neurons, your 100 billion neuron cells, brain cells, shrink by about 30%. It's kind of wild. It shrinks by about 30%. What that does is it increases up the interstitial space, which allows pulses of cerebral spinal fluid to kind of clear out the waste that build up over the course of the day. What sort of waste are we talking about? Insoluble beta amyloid that builds up in Alzheimer's disease, tau, as well as alpha-synuclein proteins that build up during Parkinson's disease. So in many ways, it's very likely that Alzheimer's and Parkinson's disease are in some part caused by poor sleep. And we know this. We know that, so I'm 50 years old. If you take someone who is 50 years old and not sleeping particularly well, they are at higher risk of going on and developing Alzheimer's and Parkinson's disease. Now, considering the fact that I probably just terrified half of the people on the call, let me reassure you that sleeping better is very much in the cards. It is very much something that is available even for people who've been dealing with insomnia for many years, even for people who've been dealing with obstructive sleep apnea for many, many years. And that brings us to GEM sleep. So I finished my training, neurology and sleep medicine, back in 2006. And very soon after that, recognized that there was just no way that myself as a clinician, seeing patients inside a brick and mortar sleep center, which I'm still actively involved in, and I have a clinical practice, but that's just not going to be a strategy in order to take care of the 40 million Americans with obstructive sleep apnea and the even larger number of Americans who are dealing with insomnia. For example, we needed some novel approaches in order to sleep better. And so through a variety of mechanisms, including apps and writing and speaking, I've worked hard to create programs so that people can sleep better without ever having to go in to see the doctor. And the good news is that for the most part, a lot of sleep disorders can be taken care of without a medication. And they can be taken care of without having to go into a sleep center to get a sleep study. In-person sleep centers are often still extremely important. I work at one, but the vast majority of individuals actually don't need that. And so we're at this very important hit moment in medicine and sleep medicine history where we can start to take care of those millions of people who are out there struggling, trying to find the right sleep. And so I've been working on that for many years. But one thing I was never able to do is I was able to help people with insomnia and circadian rhythm problems and restless legs, often without having to come into a clinic. But it wasn't until Brian Sauer, who is the CEO of GEM, approached me with this vision that he had. He's an entrepreneur, and he approached me with this vision of trying to deliver sleep apnea care to the millions of people out there who are struggling. And I was thrilled to hear this. I had been working in this direction for years, but that figuring out how to deliver sleep apnea care where you do need a diagnosis, you do need a sleep study, And then, of course, sleep apnea, obstructive sleep apnea anyway, is a mechanical problem. It requires a mechanical solution, whether or not that's a CPAP machine or whether or not it's an oral appliance, a dental device such as this. And there's other treatments out there as well. Weight loss is particularly helpful in many cases of patients with obstructive sleep apnea. And so that was in 2021, 2022. And then myself, Kelly, and Brian, and the entire team at GEM have been working very hard to help deliver a convenient approach for managing sleep problems. And just to back up on where sleep apnea has been. So in order for, not that long ago, in order for anyone to get diagnosed with sleep apnea, they needed to come in person. They would get a referral from their primary care doctor. At our center, that often means waiting months and many months in some cases to see a provider. Seeing a provider, getting an order for a sleep study, waiting several more months again, getting a sleep study, and then waiting to see a follow-up appointment, and then finally getting started on CPAP. And it's not unusual to state that it might take anywhere from 6 to 12 months to go from I think I might have sleep apnea to actually doing something about it.
Sure.
And so in that regard, let me actually bring Kelly in. We actually want to demonstrate how incredibly straightforward we have made this for a tremendous number of people, where they just have to scan in a QR code and they can do a free assessment for whether or not they may qualify for a home sleep test. Kelly, do you by chance have that available to show?
Yeah, absolutely. I think it'll pop up here in just a minute. But as Dr. Mike Howell mentioned, 40 to maybe even 70 million Americans have obstructive sleep apnea. One of the things that I thought was so interesting about that stat alone is, of that, 80% of them are not being adequately treated. And that's likely because there's a 4 to 5 month wait to see a sleep doctor, or a fear of sleeping in a clinic. And so really those are a few of the obstacles or traditional kind of fragmented brick and mortar experiences that have probably prevented folks who think they might have obstructive sleep apnea, or whose bed partner, right, is elbowing them, and difficulty with loud sleeping at night, etc. And again, that's where GEM comes into play, is we're creating a simple, straightforward, easy access to a virtual sleep clinic. So gone are the days of waiting 3 or 4 months to see a sleep doctor, but rather, as I know most of our audience here is primary care physicians, we've created a one-pager. We call it our GEM Sleep Get Started with GEM Sleep flyer. And referring your patients is as easy as handing them this flyer here. The patient can either scan the QR code, just like you can right now on your screen, and they will automatically be funneled into our virtual/digital experience. There's also a URL code at the bottom of the flyer as well, if they wanted to take it home and access mygemsleep.com on their computer in the comfort of their own home. So that, again, can be done either in your office or in the comfort of the patient's own home. What really differentiates GEM in this space is our clinical engagement model. I oftentimes describe it as DTS, and what that stands for is a clinical diagnosis. It stands for, the T stands for treatment, which is treatment education and treatment options. GEM Sleep is a DME, durable medical equipment, which means we can drop ship a CPAP to your house. Through AI technology, you can use your phone for a virtual CPAP face mask fitting. And as Dr. Mike Howell also showed you a mouth guard previously, we also educate, thank you, our patients on another treatment option that a lot of folks aren't aware of, which is oral appliance therapy. And that essentially moves the mandibular outward. It opens up the airway, and it is just as effective of treating mild and moderate obstructive sleep apnea. I can share with you, my husband is exactly the candidate who said, I will never, ever, ever, ever wear a CPAP, Kellie, which meant he was never going to take a sleep test. And I said, well, lucky I'm in the sleep space now. He took a disposable and recyclable home sleep test. It's just as simple as putting it on your wrist, like a watch. The lead goes up to your index finger. You sleep just one night, and then you can recycle that. We've got nurse practitioners and board certified sleep doctors that will interpret those results and provide a diagnosis to the patient almost immediately. At that point, as I mentioned, the patient will have an option depending on what their results indicate as to whether they want to go a CPAP route or oral appliance therapy. And then last but not least, to get to that DT and the S, it stands for support. At GEM, we offer a high-tech, high-touch wraparound patient support experience. Why that's so critical is we know that 50% of people who use CPAP in the first 30 days fail, and we want to support them and provide that level of barrier challenges support in those first 30 days to even up to 120 days to essentially get our patients on autopilot.
That's great. I love the support aspect. That's important.
Yeah.
That's great. That's kind of more of the direct primary care approach, right? So
yeah.
Dr. Howell, you are able to kind of focus your time and efforts on, you're in the weeds on this sleep. Sleep is fascinating. You're right. And I love that you mentioned your professional athletes with the Olympics coming up. That's great timing. It's just, great timing. But I'm wondering, with your time and your research into sleep and all the things that GEM is doing, Kellie, Dr. Howell, how can our DPC docs, our primary care docs that are spending time with their patients, they're not in that traditional model where, it takes months and months and months, right? Like these DPCs have access to their patients and the patients have access to their docs. So how is GEM working, and how can DPC docs work with these guys to kind of get patients the care that they need?
Well, we thank you very much, Dani. We recognize that your DPC hint docs are already, this is just another one of those challenges that your patients have, and it's difficult. It's difficult to manage obstructive sleep apnea, and so we want to make this as convenient as possible for the hint providers. And this situations can include you're struggling with someone who has elevated blood pressure, and we know, of course, if you can treat obstructive sleep apnea, blood pressure can frequently go down substantially, as well as decreasing overall cardiovascular risks, strokes, heart attacks, in addition to just helping people deal with their mental health. But it's really as simple.
Can just solve everything, right? That's what we're going for.
Well, I can't overstate it and say that it'll solve everything, but this is, sleep is 1/3 of your life. And when I went to medical school, sleep occupied 1 hour lecture in 2 years. So this is, fortunately, we are finally coming around to the idea of recognizing how important sleep is in terms of taking care of all sorts of other challenges. But in terms of just trying to help your providers, I think we can help in all stages. So in particular, just patients of, is this appropriate for me to even do a sleep test or not? They just scan in the QR code that Kellie showed. They do a very brief assessment to see if they have a high pretest probability for sleep apnea, but also don't have the contraindications for a home test, because home sleep tests is for the vast majority of people, but it's not for everyone. So if individuals are struggling with congestive heart failure, COPD, they've recently had a stroke, a few medications like opioids, those are really appropriate cases for an in-person sleep center. But for everyone else, an individual who may be appropriate for a home sleep test, we can help with that. We can then very quickly help get the diagnosis, because as I'm sure your providers know, patients have a limited degree of motivation for any particular problem, right? They have, it's on their radar, and I've experienced this myself. It's on your radar, and then 3 months and 4 months and 5 months go by, and you're just, there's a new problem in your life, or there's, stress at home or job or work. So part of what we can do is we can bring that home sleep test to the patient quickly. So after someone completes the assessment, they can get a home sleep test mailed to their house within a couple of days. They can sleep with it that night, and they can get a diagnosis within 48 hours after that. And then, but Kellie really hit on something extremely important. And this is, it's actually, once you have an engaged patient, it's not that difficult to diagnose sleep apnea, and it's not that difficult to get a treatment to a patient. But what's really challenging, and what makes the difference, both in GEM as well as in my clinical practice, is the degree of support. And this is one of the things that I'm most excited about with GEM, is that we are able to provide a coaching service that most general practices just can't provide. Sure. Because they're not built that way. In particular, for someone who is starting a CPAP machine, they can get text messages of, "Hey, Mike, you did great with CPAP this weekend, but I noticed something happened. Are you struggling at all? Do you need a new mask?" And you're kind of embarrassed. You're like, "Oh yeah, I went on a camping trip, and so I didn't use it." But just a little bit of the hand holding and encouragement that we know, that motivational interviewing that we know is critical for actually making behavioral change. If people can get to the point, those first 2 to 3 weeks are just pivotal. If we can get through those first couple of weeks and really help people start to see the benefit for their CPAP or their treatment with their oral appliance, they will just start naturally using CPAP. We all know patients who love their CPAP machine, and their biggest problem is what happens once every 3 years when the power goes out. And we also know all the patients out there who the CPAP machine has been collecting dust in the closet for many years. And we can help both of those folks both either make CPAP work for them or get them moved on to some alternative treatment, whether or not it's an oral appliance, whether or not it's a surgical intervention.
That's great. I think you're right. That support aspect is so important, and it really makes it stick, right? And we all know that DPC docs do it all, but sometimes there's just so many hours in the day. So it's nice to kind of extend their ability to provide that patient care to their panel by giving, experts and the support on the sleep specific needs of those patients. So that's great. That's fantastic. We appreciate you kind of walking us through all of that. What are those success stories? Kellie, you mentioned your husband is a great example. Have you seen, what are some other, patients that you've treated, Dr. Howell, on, that have had and really seen the benefits of, working with you?
The three most common benefits are, number one, and sometimes it's actually the bed partner who's happiest. But we frequently have, and it's so more women definitely have obstructive sleep apnea, but this is the majority of which is middle-aged men. And so this is one of the most common comments I hear is, "My wife will sleep in the same bed with me again." And so that's understandably a pretty big one. The second is that a lot of us are tired and fatigued to a degree that we attribute to all sorts of other things, and then are incredibly surprised by how much better they feel once they get their sleep apnea treated. For example, especially as you have a family and job and everything else just kind of builds up on you. People come to the assumption that, like, "Oh, I'm tired during the day. Yeah, I fall asleep during meetings during the day. As soon as I start watching a show with my significant other, I'll start dozing off." Doesn't everyone? Actually, the answer to that is no. Not everyone does that, and you can both be able to feel more awake and alert with your family and your kids and your spouse, but also. If you just want to, a lot of the enjoyment of life is just sitting down and enjoying something passively, right? Like, I'm all about exercise and keeping busy, but in addition to that, sometimes you just sit and want to watch a show or watch a baseball game. And if you have untreated sleep apnea, good luck. And then finally, we're becoming more and more in tune to our long-term cardiovascular risk. It was said centuries ago, but it is still true, which is you are as old as your arteries. And one of the best things that you can do to promote vascular health is sleeping well and taking care of your obstructive sleep apnea if you have it. And so long-term, by controlling blood pressure, controlling diabetes, by decreasing, by avoiding the oxygen drops that occur with obstructive sleep apnea. All these things help decrease this risk of heart attacks, strokes, atrial fibrillation, sudden cardiac death, fall asleep motor vehicle accidents.
Yeah.
And our patients fortunately are often monitoring their own sleep, whether or not they know it or not, because they have wearables, right? They have a Fitbit or Apple Watch or a Ring that's letting them know that they're not sleeping particularly well.
I can add one GEM patient story as well. It was actually a friend / old colleague of mine who too was prompted to take a sleep test. Otherwise, she probably wouldn't have if she didn't know that I was now working for GEM Sleep. She was just caffeinating herself, drinking coffee all day long. And that's how she thought that was going to be the rest of her life. And when she took a home sleep test, her results came back that she had an AHI, which is the amount of times you stop breathing per hour, of 35. So she stopped breathing 35 times an hour all night long. And was diagnosed with severe obstructive sleep apnea and now wears a CPAP. And she was like, oh my gosh, I just cannot believe how much energy I have. And this is a real life friend, family, patient testimonial, one of our first patients that went through the GEM experience. And it was just so refreshing to see that this truly was like life-changing for her. And we hope that that continues to be the case with the rest of our patients as well.
Dani, actually, I have two more quick ones for you. Both relate to athletes. So when you look at athletic performance, what you're looking at is great brain performance. You're looking at when a ball is coming in at 97 miles an hour, your brain can either respond to that or it can't. There's very little.
Clearly a baseball guy.
I do like baseball. I
love it. Keep going.
But yeah, so by treating sleep apnea, that 97 mile an hour fastball now looks like 92 or 93, which is a lot easier to hit. Both of them would be difficult for me to hit. But even if you are not an elite athlete, we're all athletes to some degree, right? And one of my favorite studies demonstrated that treating sleep apnea can improve your golf game. And frequently by as many as 3 to 5 shots. And I don't know if you know any. Oh yes, now you definitely have their attention. I can't tell you the number of patients who I tell them that, well, yeah, you'll have lower heart attacks and strokes. They're like, well, you haven't really sold me. But if you tell them that they can drop 3 shots on their game, believe me, a lot of golfers spend a lot of money to drop 3 shots on their game. Yes. And so there's good reason for that. Everything we talked about before, which is rewiring the brain appropriately, having the signal, losing the noise, getting the toxins out of your brain, and building up those energy stores.
That's great. Always love those athlete examples. Another question for you, maybe the last question that I'll have for you, is more on this collaboration idea between our primary care and GEM. So if, let's say that a DPC doc sends a patient through the GEM sleep experience, they take the sleep test and are diagnosed, they're using the support that GEM offers. What about collaboration between the DPC doc that initially referred and GEM? Is there any type of kind of communication? Kind of talk us through how that works.
We can definitely arrange for the providers to have all of the notes from both the sleep studies so that they have an idea of, like, does this person have sleep apnea? How severe is it? Is there oxygen desaturations? And then subsequently, what was the treatment engaged, and how did it work or did it not work? Were the patients able to be adherent on the treatment or did they not? How are they doing with CPAP? How are they doing with an oral appliance? We can provide, and let me actually pick, Kelly, do you have anything else to add in terms of the interactions?
No, I think that you hit that fairly well. We are excited to partner with each practice specifically. And if there are intricate partnership referral requirements on your end, I'd be happy to connect with you and talk through what that would work best for your practice or for your referring patient experience.
That's great. That's wonderful to hear that you're open to that. Okay, well, this has been a really great conversation. Thank you for sharing all the insights. Dr. Howell, we appreciate you. Kellie, thanks for adding and telling us more about GEM and showing us where we can learn. You can hit this link that's up here on the screen to learn more and get started with GEM and find out more about them in our ecosystem. And I just have to plug one more time, Hint Summit is coming up in September. So we hope to see everyone in Denver and collaborate more with all of this great DPC community. So thanks, everyone.
Thanks, Dani.
We'll see you next time.
Bye, everyone.